You've probably seen Dr. Sean Murphy or Dr. Meredith Grey save a patient's life with their own hands and be like, wow, I too want to be like that. I too want to save patients with these own hands. You know what? I was the same too. I wanted to create magic with these hands after watching those surgeons in those TV shows. Yes, my dream has officially come true. I'm Dr. Adarsh and I have completed my MS General Surgery from Safdarjung Hospital, New Delhi. And through this video, I'm going to share with you something that these TV shows never show you, the dark side of residency. Yes. During my residency, I always felt that before I became a first year PG, I wish someone had looked me in the eye like an elder brother and said, listen, your journey is going to be tough. Not tough like cracking an exam or studying for an exam, but really tough because your life is going to change in these 3 years. Tough because it's going to challenge you both physically and mentally. And you need to be strong to face them head on and don't give up in between. And right now, I'm that person. Looking right into the eye of my younger self who was exactly like you. Excited, scared, and ambitious. I'm gonna be that person for you to prepare you for this rough journey. So buckle up your seatbelts and get ready for the journey. So, congratulations, you finally got your dream seat, and now you're an official first year surgery PG. Now, here's the first truth, you need to forget your rank first of all. You need to forget all the glory and hard work you have done till now because from now on, you're gonna start from zero, absolute zero. It doesn't matter your rank was 10 or your rank was 1 lakh because each and every one of you is gonna be treated the same. You're all first year PGs now and you are starting from zero. In the initial days, you'll feel like you don't belong here. You'll be aimlessly running behind your seniors. You'll get confused between PDS and proline when your seniors asks you or when assisting for a dressing. Even the nurses will know more than you and you'll feel like, am I in the right place? Did I make a mistake by choosing surgery? Now hold on before you let the negativity take over. Every resident before you has felt this, but not everybody says it out loud. And you know why this happens? Because you're like a new gear who's trying to fit into the already running engine. So it definitely takes time and a little bit of patience. What do you need to do during the initial days? Because the initial days are going to be very hard. You're going to have sleepless nights. You will have to skip meals sometimes and even test your physical limits by surviving long duty hours. Mine was 84 hours without a break. That was the highest. It so happened that every sixth Sunday will be our double emergency, and we had 6 units at Saptajan. So one Sunday we had a double emergency. Monday is our OT days, and every Tuesday is our regular emergency days. And Wednesday is to settle in all the patients we have admitted, complete the pending OTs, write the case sheets, allot them bed, or prepare them for OT next day because Thursday is also our OT day. So it so happened that our duty began at 9 a.m. in the morning and ended at 9 p.m. on Wednesday. So that was a total of 84 hours. Yeah, that was my most hectic duty. And I even have experienced dozing off while walking. But slowly, we learned to cope up. We learned to squeeze time for ourselves. We took power naps whenever we had free time. And we always kept a protein bar in our pockets so that even if we skip meals, there will be something in our pockets to have to eat at. And did whatever the seniors asked us and tried to fit in as early as possible. But why am I sharing this with you? Because you need to know what you're signing for. I don't want you to take up this seat just because of FOMO or just because you see some influencer or in a movie. You really need to know what you're signing up for and what you're going to face. And are you capable of tackling those problems or not? Because a lot of people, just because of FOMO, get into surgery residency. And the result, they quit midway. And most of them quit within the first 6 months of their first year residency. And here are the stats. A total of 1120 PG dropouts in the last 5 years, out of which maximum number is of surgery, 114. And one of the reason is toxicity. Surgical branches have a strict hierarchy and hence the maximum toxicity. You will be yelled at, humiliated, and even thrown out of the OT for the mistakes you didn't even know you were committing. There will be some sadist seniors who will enjoy humiliating you, but there are also some seniors who genuinely want you to learn. They'll scold you, they'll humiliate you, but for a reason, just for you to learn. So make sure to figure out who's who at the very earliest. Because there's a paragraph you're gonna hear a lot during your residency days. हम भी पहले गए थे, तुम भी पहले जाओ. And once you become seniors, you will continue the same to your juniors, because that phrase keeps running in your mind. Try not to be a toxic senior once you be a second year. Definitely scold your first years if they commit a mistake or they don't follow your orders properly, but not by humiliating or insulting them, but correcting them in private. Because these 3 years will change your personality completely. You'll become more alert, your decision making skills will sharpen, your problem solving skills are going to improve. Also, you will develop that surgeon's aura around you. You'll feel like the most powerful person in the world, but also you may lose your soft side, you may lose your smile, you'll become more aggressive, or worse, you may forget who you once were outside these hospital walls. So make sure you enjoy your residency days to its fullest. Along with learning, you need to have a life outside the hospital as well. Talk to your friends, talk to your family, go for that movie, or if need be, take a leave and go for that trip you always wanted to. And the most important thing, don't forget to make a strong bond with your co-PGs, your seniors, and your juniors, because they're gonna be the only family for these 3 years, and they're gonna be for you whenever you're in need. Try to be as humble to your seniors as possible and learn as much as you can from them before they complete their course, and do the same to your juniors. Teach them as much as possible before you complete your MS general surgery. Now coming to what to learn during these 3 years of your residency. See, nobody is expecting you to perform a laparoscopic surgery once you become a third year PG or immediately after you pass your MS general surgery. What you need to concentrate is perfecting the basic skills first. Basic suturing, making a clinical diagnosis, handling the ER, inserting ICDs, inserting drains, handling bowel, proper assistance. You need to know what instruments is used for what. You need to know basic minor OT procedures like excising a cyst or excising a fibroadenoma. And once you master these basic skills, then you can go to master the advanced techniques like laparotomies, laparoscopic procedures, or other minimal access procedures, and big surgeries like GI malignancy or CA breast. So make sure in the duration of 3 years, you master these basic skills as much as possible, because you can perform these advanced surgeries your whole life. So make sure to constantly keep practicing those basic skills and upgrading your knowledge. Now, what to read during the residency days and how do you manage time for that? Keep one thing in mind, you won't have any specific time for studying. You'll need to make efforts to read during your free time. For example, you're shifting a patient to OT. Suppose he's posted for amputation. So in the elevator, you read the steps of amputation perhaps. Or if you have more time before the anesthesia is given, you can even read the theory part of amputation. Or you see a patient, a fibroadenoma in your OPD. So when you return to your room, you quickly go through the theory part of fibroadenoma and what are the management protocols for fibroadenoma. So this is how you're gonna study during your 3 years. And don't make the mistake I made. I focused more on mastering my surgical skills and little less on theory. And the result, I failed in my pre-final exams and had to finish entire Bailey and Sabiston in just 1 month's time to pass my MS General Surgery. I don't want you to do that. You have to read whenever you get free time and try to make a small note. And what are the problems you're going to face during the residency? You already know you'll be skipping your meals, you'll be sacrificing your sleep, you'll be missing a lot of family functions, but also you are at a risk of developing tuberculosis. You are at a risk of being pricked from a seropositive patient like HIV or HBsAg. You may even develop varicose veins, which 3 of my juniors have already developed. You may have cellulitis, you may have fungal infections, you may also have contact dermatitis due to the powder gloves. So make sure you need to prioritize yourself before taking care of the patients. You need to maintain personal hygiene. You need to follow standard aseptic precautions. Maintain proper sterile techniques. Always wear a gloves before touching a patient, and always wash your hands properly after you examine a patient or after you've been in a surgery, and always wear a mask. And most important thing, don't forget to smile. You don't want to be called a khadu senior now, do you? Now you've done everything right and finally cleared MS General Surgery. What's the future scope for you? Just because you have passed doesn't mean you're a full-fledged surgeon. This is just your beginning step. You will need at least 10 years to become a fully fledged surgeon and perform surgeries confidently. Your friends from non-surgical branches will settle early, and you will have a long learning curve before you master surgery and are able to earn decently. So you'll be at least 35 plus before you start earning decently. So, but remember one thing, surgery is an art, and a surgeon is the artist of the highest order, because you can't afford even the tiniest of flaw in your art when there's a life at stake. You're gonna have magic in those hands of yours, and you're gonna feel that powerful aura around you, and you are gonna feel like the most powerful person in the hospital campus, just like watching the people in the TV series. So choose this branch if you're ready to make those sacrifices and are ready to face all these challenges head on like a warrior without any regrets. And if you found this video helpful, share it to your friend or your junior who's dreaming of being a surgeon too. And don't forget to subscribe, because I've got a lot of more wisdom to share with you.